Kevin Henry with Dental Economics here in our hometown Tulsa, Oklahoma, talking today to Dr. Charles Keithline, the Pediatric Dental Group. And this is a great, aesthetically pleasing building. Whenever you drive by this area, you can't help but notice it. So talk a little bit about some of the things that you wanted to do with the design of this practice.
Exactly what you're saying, okay? We wanted to make a nice environment for the kids to come and have their dental work done. Kids from every economic walk of life, and that way we can do a good job for all of them.
And really, tomorrow's your year anniversary.
We've been here right at a year.
So talk a little bit about what the last year has been like for you.
Well, at first it was pretty interesting. I felt kind of lost in this big building. Coming from a 3,000 square foot building, moving to a 10,000 square foot building is a big jump. But fortunately, the patients have been here, and we've pretty much filled this building up. We're not only treating kids over here on this side, we're also doing another group of people that need their teeth fixed. That's moms, and we call it OB dental over there, where we're trying to get the bacteria count down for the parents before their babies come, and hopefully we'll slow down the progress of decay to their children.
And we were talking before we started this interview about how important that was to you personally as well as to your practice.
Well, it's not, it's important to the baby more than anybody.
Yeah. Well, do they get the message, or,
Well, the message is logical. I've gone through that with you, and it's just, there's nothing magic about it, okay? If you feed the bacteria, you're going to grow the bacteria, and if the bacteria in your mouth, it gives them plenty of time to destroy your enamel and cause cavities. Whereas if you limit the bacteria growth and not feed them all the time and remove them real good every time you brush the baby's teeth, then obviously they can't grow in as many numbers and reduce the number of decay. Period.
What do you like most about this practice? As far as design goes, and just as far as even people?
Just being able to take good care of the kids. We not only do regular dental treatment like in this area, we do cleanings and orthodontic adjustments and stuff like that over there. We put the kids to sleep over in this other part of the building. And of course, like I said, we have an adult clinic over on the other side to take care of the needs of the parents so that the babies don't get the cavities. We've got a big mission here, and this facility allows us to fulfill that mission better than I ever thought I could.
You told me beforehand about how you moved from a practice where you've been for quite a while to this one.
We were in the last office for 15 years.
So what kind of process was that for you?
At 13th and Rockford. Well, I felt very not at home for a long time, and to be honest with you, I still, I don't even know who's in this building a lot of times. Whereas in the other building, as soon as someone else came in, I could hear them talking on the other side of the building, and I knew they were there. If I was expecting them. In this building, people come and go, and often I don't even know that they arrive. So it's very difficult.
What's one piece of advice you might give to somebody who's looking to build a new practice or relocate?
Oh gosh, there you go. I wish you'd asked me that ahead of time. I would have had an answer. I guess making sure you get your financial ducks in a row ahead of time. Okay. That's one other thing about this building that you need to know. I didn't just plunk down $3 million for this building. Okay, it's built with part of some investment tax credit that has allowed me to build this building in a fairly depressed economically part of town, so that we can afford to build this kind of building. We've gotten some concessions from the bank in terms of being able to afford to build.
The last question for you. You mentioned this part of town. This is really, to me, this is kind of maybe a little bit of revitalization of this part of town.
Exactly. The Pearl District part of Tulsa is a up and coming project. The idea is to create an economic area in this park where people like to come and go and shop and look for things that they want to do of interest, and hopefully this area will be part of that, and I'm kind of on the corner of it.
Yeah, absolutely. Well, I appreciate your time. Thanks
My
for
pleasure.
sharing with us.
Thank you very much.